Hello, myself, Dr. Ananda KNR, Assistant Professor of Physiology. So, welcome you all for today's session. Today, we are going to see about blood grouping and its implications. So, before going to blood grouping, all of you know that we have common blood groups. Like all of you would have mandatorily taken your blood grouping, which is mentioned in your Aadhaar card, license. So wherever you are, even common school ID card, college ID card, they ask you what type of blood group you are. So all of you would have mentioned regarding like A positive, B positive, O positive, or A negative, B negative, O negative, or AB positive, AB negative. So blood grouping, as a general knowledge, you all know that all of us have a different blood group, and this blood group is very important because for in case of blood transfusion, you need someone's blood. This blood grouping is what we'll look after. This is a very preliminary knowledge. I hope all of you will be having. But blood grouping is not just that. We'll see into it. So we'll find out what is your blood grouping, how many types of blood groupings are there, why, how is the blood grouping is based on. Like you need to know what is the physiology or what is the science behind the different blood groups. Okay, so this is what we are going to see today. So yes, I hope you will enjoy. So yes, anything in your medical field, anything you are going to learn, it's not just going to be a chapter. It's going to be a part which you are going to play in someone's life. So the chapter we are all going to learn may save someone's life tomorrow or today or maybe near future. But anyways, it is life is very precious, and as a doctor, as a medical student, you have a very great potential of saving someone's life, which is like priceless. Okay, so we'll, without wasting much delay, we'll just dive very deep into it. So this is just a learning objective, what we are going to target on. So we will be learning regarding the different blood groups, how to describe them correctly, what is Landsteiner law. As a part of your theory exams, you would have already faced these questions, or you will definitely face, or even in Viva, and discuss the clinical importance of this blood grouping, what is the importance of blood banking, and why it should be done correctly, and importance of your blood transfusion. Okay, so these are all the things which we are going to see. So without wasting any more time, let's go directly. So now human red cells, they have numerous surface structures which are coating around the cell membrane just like other cells. You also have a red cell, just your RBC or erythrocytes, which are going to have a numerous antigens or structures which are placed on the surface, which your immune system recognizes it. And these structures or the antigens is what we term them as blood group antigens. Okay, so just before going to know the basics, you will come across these terms very frequently. So I'm just introducing you to them. So the blood group antigens, we usually call it as agglutinogens. So easy remembering, gen it ends in antigen and agglutinogen. So agglutinogen is a blood antigen we are talking about, and antibodies are called as agglutinates. Okay, and when the antigen antibody complex is formed, or when the antigen antibody reaction is formed, the complex we call or the process we call it as agglutination. Okay, so these are the three things which you will be constantly hearing throughout this lecture. So I'll just introduce you to the term. And just as an intro fact, so as we are speaking in 2025, this is November. So we have two new blood groups which have been added until 2024, we had like around 45 blood grouping known systems, and 25, 24, and 25 have added two more new systems. So this proves the essence of keeping ourselves updated on the current knowledge, and also there is the scope of finding more and more in this field. So particularly medicine, is a very newly evolved science branch. Okay, so you should all be aware, like the last advancements, whatever we have got is in the last 100 to 200 years, in compared to the history of mankind. So what we know is very limited, and the possibility of us to know is very huge. So this part has is very important because you are going to be the future minds, or you are going to be the future workforce who's going to exploit this. So always have that questioning in you. Always ask why, and then sometimes you will get the answer, sometimes you will find the answer, or sometimes you will pay for others to get the answer. So, anyways, the human society grows. So, yes, so there are non 47 known types of blood grouping based on around 370 to 380 antigens, so roughly 400. So, we are having around 400 antigens. Based on those antigens, we have blood grouped into around 47 known types. Right. So, coming to the Landsteiner law. So Carl Landsteiner, on 1900, when he discovered this blood grouping, he gave us a set of two laws. Sorry, set means two. So he gave a set of laws, which is basically two laws. So one, which is if an agglutinogen, which is antigen, if an antigen is present on the RBC membrane, the corresponding agglutinin, which is the antibody, is absent in the plasma. So what does it mean? That if you have a particular type of antigen on an RBC surface, the corresponding antibody. Okay, so for example, you have a antigen, the A antibody will be absent in plasma. And if you have a B antigen, B antibody is a corresponding antibody which will be absent in the plasma. Okay, this is the first law. And the second law, if an agglutinogen is absent on the RBC, then the corresponding agglutinin will be present in the plasma, which means that if you don't have A antigen, you will be having A antibody in the plasma. And if you have B antigen, you will be having A antibody in the plasma. Okay, so just don't get this more confused. It's very simple law. Both are vice versa laws of each other. If you have an antigen, you will not have that antibody. If you don't have the antigen, you will have the antibody. Okay, so this is the law which Carl Landsteiner gave in 1900. Okay, but this law holds good only for your ABO blood grouping system, but it does not apply for your RH system. We will come to it, what is RH and everything. So RH is typically the positive and negative blood grouping which we would have been exposed since your schooling, and all the requirements for your ID card, A positive, not positive or negative indicates your RH. So it does not apply to the RH. It applies to only your ABO blood grouping system. Okay. So now coming to the grouping system. So we have major blood grouping and we have minor blood groupings. So major systems are based on agglutinogens which are very widely present in population. Okay, because not all antigens are present because we have ethnicity, race, we have phenotypes. So basically, not all the population in the world will be carrying the same kind of antigens because whatever race or ethnicity they are based on, the blood grouping antigens can change. So widely, what are the antigens which are present? Those are all classified under your major blood grouping. And if the blood groupings are based on only a very small population, then we classify them as a minor blood group. Okay. So in fact, the interesting fact you can know is that even the process of migration, that is in the theory of evolution, we all know that from they say like from Africa, the population migrated to Asia, then to South Asia. So from there, the origins have started. We have diversified. So all those things, in evolutionary point of view, through blood grouping or prevalence of blood grouping, we can predict that this is how the migration happened. Okay, that's what your essence of your blood grouping is in terms of your history aspect. Okay, so your classical ABO and your RH. These two systems we classify them as major blood grouping systems, and we also have minor blood grouping system which we use for forensic purposes or paternity tests or other. For example, your MNS blood grouping system, which we primarily use in forensics to identify the father. Okay. For along with that, you have P blood grouping, Lewis blood grouping, Lee blood grouping system, Duffy. So Duffy has an important role to play in your malaria, and we have Kell, Mal, ER, and your Gwada. So this ER and Gwada were newly added. Okay, as I told you. So if you take Gwada, there to known humankind, there is only one person who is Gwada positive. Okay, which was recently discovered as a new antigen, which was added to the list of blood grouping antigens by the uh, International Blood Grouping Association. So now coming to the importance of it. So why do we need this? So first one is compatibility for your blood transfusion. So in case of your accidents, you are someone who meets with an accident, there's excessive blood loss, or you're doing any surgeries or anything, you need a blood. So we for transfusion we particularly need this, and for understanding hemolytic diseases, for example, like what is the cause of the hemolysis, whether the antigen antibody reaction is there or why the hemolysis has happened. Hemolysis means destruction of your RBCs. So why this is happening? So to find out or to get a more insight knowledge, when we will be using this blood group system. Next thing is susceptibility to infection. So this susceptibility is a genetic factor again, and your certain blood groups are very much prone to certain diseases. Okay, so since this is of very significant value, we can anticipate, okay, this person can develop this kind of infections. Or for example, as I told you, Duffy is very important in malaria. Okay, because persons who are having this Duffy antigen group, so they are very minor population, mostly American blacks. So what they will be more prone to the Vivax malaria. Okay, so this plays another important role. Next is your clinical disorders. As I told you, since your antigens are coded by chromosome 9, so it has a genetic component to play, and they predispose to certain genetical conditions. And next is your paternity test. As I told you, paternity test will when there is going to be a legal case, who is the father, like or the father of the baby is unknown, and you have two fathers claiming, so you need to know whose baby it is. Then your ABO testing may not be enough. Okay, it can narrow down, but it will not be definitely enough. So then you go for the minor grouping like MN system. So the MN system will definitely help you in this paternity cases. Next is human behaviors. As I told you, there are a lot of studies which have been done. So one, for example, like in crime scenario, as I told you, you can do a paternity test. You can dispute the case. And as I told you, the associated diseases, for example, your blood group A has chances of carcinoma of salivary gland, stomach, colon, rectum, or coronary thrombosis, pernicious anemia. Blood group B is more associated with E. coli infection, UTI, gonorrhea, and blood group O is more with peptic ulcer, rheumatic arthritis, typhoid fever, von Willebrand disease. Because typically O blood group will have very decreased von Willebrand disease, thereby increasing their clotting time. And your Duffy, as I told you, Duffy antigen is for more associated with your Vivax malaria. So if both your Duffy has two antigens, basically, when both of them are present, it makes the person more susceptible to Plasmodium vivax. And similarly, other blood grouping system also in will be helpful in identifying the disease pattern, as you can see in the table which I have posted. So next is, as I told you, this is one of the study which was done by me when I was a postgraduate. So basically, the anthropometric relations between ABO blood grouping. So it varies from ethnicity or from place to place. Why? Because, for example, in my study, it concluded that the weight and BMI are relatively higher in among B blood group people. Okay, and height is more, height of the person is relatively more, which is of significant value on A blood group. So these data are little more suggestive or gives insight regarding the characters, even determining the characters of a person in psychology. So blood grouping has its own kind of personality types, which are recently evolving, recently on, which is like studies are which are recently on trend that to classify human behaviors. So blood grouping has such of importance also. So now coming to the point of your ABO system. So as I told you, so in ABO system, which is a major system, what we have, so we have four blood types in it, A, B, AB, and O. So A, which means that you have antigen A, and according to Lanston and law, if you have antigen B, what antibody you will be having in the plasma will be your anti-B. So which is your B antibody. Okay, and the genotype of A blood group person can be either AA, but that is two alleles can be of the same A group, or it can have A and O. So if A and O are there, relatively A and B are very dominant alleles, so they take over. So the allele type can be AO. So that is your mother or father can be O, or the other parent will be A. So you will be receiving your A allele and O allele, and since A is being dominant, you will be expressing it as A. Okay. In case of B blood group, you'll be having B antigen and you will be having anti-A according to Langston law again. So A antibodies will be there. Allele group genotypes will be either capital BB or BO. In AB, you will be having both A and B antigens present on your RBC membrane. And since you are having both antigens, you will not have any antibodies present in the plasma. Okay, so they don't have any antibodies circulating in the plasma. And since they have both antigens, AB group is called as your universal recipient. Okay, and we'll come to it regarding your RH factor if it will complete the sentence, but general. And coming to O, you will not have either A antigen or B antigen. So you will be having both the antibodies circulating in the plasma. That is, you will be having anti-A and anti-B. That is A antibody and B antibody. Right? So just a pictorial representation how it looks. So you in RBC, if you look at A antigen, so you will be looking at antigens which are surface antigen, and you have a corresponding antibody for it, but which will not be present here because then it will destroy. So you'll be having anti-B, which is having a different structure. Similarly, B antigen, which is of triangle or Christmas tree here, will have a anti-A antibody, so they do not match. So the antigen antibody reaction doesn't take place. So in AB you have both, so you will not have any antibody. In O blood group you will not have any antigen, so you will have both the antibodies. So O negative, we call it them as a universal donor because they don't have any antigens present in them. So if antigen is there, then only antigenicity, that is the property of antigen to cause immune reaction is we can't say it's zero, but it's close to nil. So in case of AB positive, then they have both their antigens present, so they can receive blood from anyone, so that they do not react because they have both antigens, they don't have any antibodies to react up against it. So even if you give A or B or O, so they can receive the blood. So AB positive is what we call it as a universal recipient. So now coming to the ABO. So I was telling you regarding this A antigen and B antigen. So what is exactly is A and B? So antigens on your RBC can be glycolipids or glycoproteins. It's either any one of these. Usually glycolipids in nature, and antigen on other tissues can be glycoproteins. So this antigen, ABO gene, is an autosomal gene. So they are located on chromosome 9, as I have told you before. So this A and blood groups are dominant over the O, so which means that you have A allele and O allele. There is a chances that the blood group is going to be A because A is a very dominant allele over there. So A and B genes are codominant in nature, and antibodies of this ABO blood group belong to IgM type. This is very very important. Why? Because when you are in future, when we are discussing about hemolytic diseases of newborn or RH incompatibility diseases, so I'll tell you. like why the baby is developing hemolysis and also. So this is of IgM type. So you all know that you have IgG, A, M, E, D. You have five antibody classification, immunoglobulins classification, and this ABO system or ABO antibodies are of IgM type. So now coming to the O. So it necessarily not means that O means absence of antigen. So what we have is a structural based grouping. So H antigen, the H gene, which is present on chromosome 9, will be coding for Fucose transferase enzyme. So this Fucose transferase enzyme, because name says transferase, and what is it transferring? Fucose. So it transfers Fucose. So what it does is it puts the Fucose on the glycolipid or glycoprotein on the RBC to form a H antigen. Okay, so basically the structure will be something like this. So you have a lipid bilayer, just like other cells, your RBC layer membrane. On RBC membrane, you have a protein molecule, as you can see here. On protein molecule, this Fucose transferase will add the Fucose to the basic glycoprotein component. For example, your ceramide, glucose, galactose, then acetyl galactosamine, galactose, and you have a Fucose which is added to it. So this is typically the H antigen, or you can call it as a parent antigen, okay, which will be present. So which is a indicator of your ABO blood grouping system. So now on top of this H antigen, when you have a specific gene which is coding for a transferase of N-acetyl galactosamine on top of your H antigen, then it becomes a antigen. Okay. So if you look at the structure, you have the same ceramide, glucose, galactose, N-acetyl galactosamine, galactose with a fucose attached. Till this point, it is a H antigen. On top of this, you have an enzyme, transferase enzyme, which is putting N-acetyl galactosamine on top of it. Now this structure is different, and this structure is what we call it as a antigen. Okay, and instead of this N-acetyl galactosamine, if the gene is coding for a transferase enzyme which is putting galactose on top of this H antigen, then this becomes a B antigen. So same ceramide, galactose, N-acetyl galactosamine. You have another galactose here which is attached to fucose. Till this makes your H antigen. On top of this, you have a enzyme which is adding another galactose on top. So if you are adding galactose on top, then it becomes a B antigen. So when you have a gene which is going to place both N-acetyl glucosamine and galactose together, then it becomes a AB antigen. So you have both N-acetyl galactosamine, you have your galactose, so both are present. So now this becomes a AB antigen. And now there is going to be an interesting scenario. So now I've told you like you have an enzyme fucose transferase which is putting this H antigen. What if this fucose transferase or gene is itself is absent? So yes, that was a scenario which happened in Bombay. So we have our own Indian blood group which we call it as a Bombay blood group, okay, which was discovered because the person was identified as O blood group, and then they gave the transfusion, but he developed reaction. Then all of them were confused, like, he is O, how did he develop the hemolysis, and also then they came across that this H antigen can also be absent. So rare individuals with the phenotype of HH small, so they do not express this H antigen at all. So they produce antibodies to H antigens. So they are only compatible with their own Bombay blood group types. So if you look at their image, there will be no H antigen. So you can look at it. So that you understand the difference. Instead, there was a H antigen. Now it is not. So for that H antigen, according to Landsteiner law, you will be having an antibody. But H antigen is common for O, A, B. So anything which comes directly, the immune system is going to attack and destroy the RBCs, hemolysis, and the patient is not going to get the benefit of transfusion. So this is regarding your ABO system. So now coming to your RX grouping system. So it was the rhesus monkeys who contributed to that. So we call it as a rhesus factor because it was first identified in the rhesus monkeys. So in RH, we have total of six antigens. So capital C, capital D, capital E, and small e. Okay, so they are immunologically most active is the D antigen. So this is what we use in our laboratories also, anti-D and also. So, but we have six antigens for your D RH system. This is what you need to take home. So out of this six, your capital D is what is more immunologically active. So that's what we consider. And here RH is based on chromosome 1. Your ABO was on chromosome 9, and your RH system is from chromosome 1. And it is inherited as a dominant gene. And as I told you, RH belongs to IgG category. ABO antibodies belongs to IgM category. Okay, so why it is very important now, I'll tell you. So RH negative individual, if they are going to receive RH positive blood, okay. So for example, A negative individual is receiving A positive blood. So immediately there will be no reaction, okay, unless and until that was a first transfusion or first time exposure. So now, once in a lifetime, this can happen. That is, RH negative individual can safely receive RH positive blood once in a lifetime. But once you are getting exposed to this antigen, now what will happen is your body will start developing antibodies to it. So now your antibodies are ready. So second time when you receive the same transfusion, you will directly have hemolysis. So that will be severe. So this is the reason why in medical we have a unwritten rule that when you are treating an Rh negative female at any age before menopause, we will be having a lot of hesitation to transfer her our Rh positive blood, because once you are going to at any given scenario, unless and until it is like pure life-saving loss situation. So in that also we maximum avoid to give a female, even though it is one time you can give for to save the patient. But even in RH negative female at any age will not give RH positive blood. Why? Because the baby can develop erythroblastosis fetalis, icterus gravis, nitarum, kernicterus, hydrops fetalis. So why basically what are this is erythroblastosis fetalis? The name says erythroblast. Okay, erythroblast are immature RBC cell. Cis means increased. So your immature RBC cells are increased in who fetus, so fetalis. So erythroblastosis fetalis occurs. Icterus is a yellowish discoloration, what you are seeing, and you are seeing it in the neonates. So it is icterus gravis neonatarum. Kernicterus is the portion of your bilirubin on the basal ganglia crossing the blood-brain barrier and depositing in the brain, called as kernicterus. And hydrops fetalis is because of the excessive destruction and everything. The uh, head of the baby swells. So you have accumulation of enlargement of ventricles and everything. So we call that hydrops fetalis. So why this basically happens is because, so if you can see here, when an RH, so when an RH negative mother, okay, and we have a RH positive father, okay, so now there is a chances that he will be transmitting the positive trait through chromosome 1. Okay, so when the baby is developing as chromosome 1, the first baby, there is going to be no problem because we have a placental barrier and we have no issues. So now what happens is, because during the time of delivery, when the placenta, when the maternal and the fetal blood mixes, what develops is the mom starts developing, because she is sensitized, she starts developing the antibodies of your RH. Okay. Now, in the second pregnancy, if the mother is going to again be pregnant with positive baby, now mother has antibodies against this positive, so it crosses the placental barrier. Why it crosses? Because the antibody is of IgG type. Okay, IgG is the smallest group of antibodies what we have. IgM is the larger group. IgG is a very smaller group. So they can easily cross your placenta and destroy the baby. So that is why RH incompatibility happens. So what happens is mainly hemolysis. So because of that, you have anemia, hemolytic jaundice, and generalized edema, which can be developed. So due to severe anemia, we have your extramedullary hemopoiesis, that is outside your bone marrow. You have a lot of erythropoiesis happening. So erythroblasts, which is your nucleated red cells, are released into the bloodstream, because when you are going to produce a lot of things in a very short span of time, obviously the quality is going to reduce, right? So
if one factory can produce 500 tables in one day and you pressurize them, no, I want 5 lakh tables in one day. So obviously the quality of the table they are going to produce is going same thing with your body. So your RBC production is increased because your RBCs are getting destroyed. So your body thinks you need more RBC and when they are producing. So what basically happens is when the speeding of the process of erythropoiesis happens, you have immature RBCs coming into the circulation. There is a nucleated RBC, so the blast cells. That's why we call it as erythroblastosis.
So can it be prevented? Yes, we have lot of advancements nowadays. So injection of single dose of RH antibodies, that is your anti-D in the form of RH immunoglobulin to mother within 48 to 72 hours of birth of the first baby. So why? So once the first baby is there, you have the antigens which is circulating now. So before your antibodies or that is your immune cells recognize them, you give Rh antibodies and you neutralize the antigens. So now your body doesn't recognize your antigens or starts developing the immunity. So it doesn't go to the memory cell, starts producing your immunoglobulins. Already you give immunoglobulins, so it's kind of a passive immunity. So all the antigens are neutralized. So now your body does not have the antigen presenting or the process of formation, so it does not remove. So second thing, what you can do is always nowadays blood matching is also one of the thing which is going on before the marital agreements and everything. So or you can pre-counsel them. So if you, in case there is a RH negative mother and RH positive father, and they plan to have a baby, you can educate them that these are all the things which you need to take care of. These are the things. This is the treatment process which you should follow. So this education prevents a lot of mental stress, worry, and harm to the baby. So other treatment options include your intrauterine fetal transfusion, so which is very common nowadays in abroads and foreign countries. So as for now, India, I don't think we have successfully done it, but yes, this is a very another treatment option where the fetal because baby is starting to get affected with the antibody. So what you can do is you can do the intrauterine transfusion, take the blood and give them a new blood, so that just like the normal transfusion for the person, now you are just doing it via umbilical artery and umbilical vein. So you are doing it to the fetus. Next is exchange transfusion. So you take clear of the antibodies and you give. Second is your phototherapy. Why? Because hemolysis causes hemoglobin to be destroyed, and hemoglobin, when it comes, obviously it has bilirubin in it. So this bilirubin is what is causing all your jaundice. So to prevent the effect of the bilirubin, what you can do is phototherapy, basically the UV rays. So these UV rays will neutralize the bilirubin, which is going to be causing a lot of problems. So right, so this is regarding your ABO blood grouping system. So we have seen regarding what are blood grouping system, what is the gene which is encoding, what are the various blood grouping systems regarding your Landsteiner law, and what are the effect of your ABO incompatibility. So basically your RH incompatibility. So pretty much the basic part we have covered. So in the next session, we'll see regarding your how the blood banks works, how their blood is being preserved, what is the how does the transfusion is indicated. So what are the medical cases in which you need blood transfusion. So what are the various transfusion elements we have? We not just the blood has your RBC, you have WBC, platelets, you have plasma. So a lot of things are there in your blood. So what are the various transfusion elements which we have and how it is stored? So what are the risk and benefit ratio of this? All those things we'll be seeing in the next class. Okay. Thank you.